Is the screen visible?
Yes, sir.
So this is the guidelines for regional anesthesia in patient with anticoagulation therapy. So what are the indications for anticoagulation therapy that you should know? That can be most commonly indicated in the presence of atrial fibrillation, deep vein thrombosis, pulmonary embolism, or prosthetic valves. And patients who have also undergone stenting, they will be on dual antiplatelet agents, or patients who had a previous history of stroke or a CABG. All these patients require antithrombotic therapy. Now, what are the common drugs that are used that you must be able to remember? One is commonly given is aspirin, second is NSAIDs, third is thiopuridims, fourth is non-thiopuridims like ticagrelor and cangrelor, vitamin K antagonists, warfarin, esomeprazole, and fenprocoman. Then direct inhibitors of factor 10A like rivaroxaban, apixaban, direct inhibitors of thrombin and fondaparinux, unfractioned heparin, and low molecular weight heparin. These are the 10 drugs which are commonly used. Okay? And 4 considerations that aim to guide the elective surgical cases are: determine the thromboembolic risk. That is the first and foremost, because these drugs are administered to prevent a thrombus. Determine the procedural bleeding risk. Determine whether not to interpret the anticoagulation or thrombotic therapy, and determine whether or not bridging anticoagulation is needed. So these are the 4 things that you have to keep in mind. And based on that, the guidelines are: aspirin can be safely continued. They have proved that continuing aspirin cannot cause any major bleeding, and this has got a safe antiplatelet activity also. All the antiplatelets you have to stop 4 to 7 days before. Warfarin you have to stop 3 to 5 days before. And newer oral anti-agents you have to stop at least 10 days before. And the low molecular weight heparin stop 12 hours before, resume 6 hours later. Heparin 4 hours before and start 2 hours later. Heparin is the shortest half-life. Now, what is the difference between the mode of action of fondaparinux and low molecular weight heparin compared to factor 10A inhibitors like rivaroxaban and apixaban? I thought this will be a little useful information for you, because the antithrombin which attaches with the factor 10A and activates that is done by the drug bringing it. Whereas in the rivaroxaban and the drug directly goes and blocks the 10A. So that is the difference between the factor 10A inhibitors. They directly attach itself to the 10A protein and inhibit them. Whereas here the fondaparinux and low molecular weight, they first attach to the antithrombin in the blood and then form a coat and then go and attach. And once they do that, they extend the action to the 2A also. Whereas here in the dabigatran, here also they have a direct effect, and finally the clot formation is prevented here. Now this chart tells you about what are all the examples of drugs that are used. Anticoagulants are vitamin K antagonists, indirect thrombin inhibitors like heparin, direct thrombin inhibitors like pyridine and argatroban, dabigatran, factor 10A inhibitors, fondaparinux, rivaroxaban, and apixaban, and then antiplatelet. So the main 2 classes are anticoagulants and antiplatelets. These are the 2 categories. Under anticoagulants, you have these 4 categories: vitamin K antagonists, indirect thrombin inhibitors, direct thrombin inhibitors, and factor 10A inhibitors. Under antiplatelet, you have COX inhibitors, thiopuridims, platelet GP2-3A inhibitors, and thrombolytic fibrinolytic agents like fructokinase, urokinase. These are all used mainly during an acute episode like acute coronary syndrome. They are not on a regular basis. And so this can be omitted, and but just for the knowledge sake, they have been included in this. Now the recommendations as she said, all these things he has described, and this chart is available in most of the textbooks. So when to discontinue and when to start, all this is given in this particular thing. So I think that will complete that answer.
Yes.
Okay. So well done, Shobhita. Shobhita only presented that, no?
Yes, sir.
Yes,
Very
sir.
good. Well
Thank you.
prepared, ma. Good.